Every single day, millions of people reach for a bottle just like this. It's sitting in your medicine cabinet right now. You take it for a headache, a sore back, a fever. You trust it because it's over the counter. It's supposedly safe. But what if I told you that this one simple pill, this innocent-looking drug, is secretly putting a strain on the two most important systems in your body? What if I told you that a leading cardiologist is sending out a chilling, urgent warning? We're not talking about some obscure prescription. We're talking about a drug you can buy at any convenience store. And if you take it regularly, you need to watch every second of this video. This is the truth they don't tell you on the commercial. This is the pill. This is the damage. Let's dive in. The drug we're talking about belongs to a class called NSAIDs, non-steroidal anti-inflammatory drugs. We're talking about the big names: ibuprofen, naproxen, diclofenac. These are the powerhouses of pain relief, and they are effective. They shut down the compounds in your body that cause pain and inflammation. But that same powerful mechanism that takes away your headache is also messing with your circulatory system in 3 critical ways. Think of your arteries as a delicate highway system. These drugs, especially when taken consistently, force your body to do 3 major things. Number 1, retain salt and water. It's counterintuitive, but true. This increase in fluid volume is like dumping more cars onto your highway. Where did those cars go? They slam into your blood pressure, raising it dangerously. Number 2, they cause direct vasoconstriction. Even independent of the fluid, these drugs can narrow your blood vessels, forcing your heart to work harder to push blood through a smaller opening. It's the definition of pressure overload. This isn't a small side effect. This is a sustained, dangerous increase in pressure. High blood pressure, or hypertension, is known as the silent killer for a reason, and it's the #1 cause of damage to your arteries. It's eroding the inside of those vessels, setting the stage for plaque buildup, and putting a massive, unexpected workload on your heart. This fluid retention is particularly dangerous because it directly impacts the amount of work your heart has to do. Every extra ounce of water means the heart has to push harder. It's like constantly running a marathon. Over time, that heart muscle can remodel, thicken, and ultimately lead to heart failure. This is why cardiologists are so vocal about NSAIDs. Now, this isn't my opinion. This is the explicit warning from organizations like the American Heart Association and the FDA. In 2015, the FDA actually strengthened its warning on non-aspirin NSAIDs due to the risk of serious, even fatal cardiovascular events. And the cardiologists I spoke to for this video all agreed on one critical point. It's not about the one pill you took last month. It's about the cumulative effect. Cardiologists warn that regular, long-term use of these drugs can lead to an increased risk of heart attack, stroke, and heart failure. Think about that. A heart attack from something you bought without a prescription. Here's where the confusion often begins. You might be saying, but my doctor told me to take an aspirin a day for my heart. That is the aspirin paradox. Aspirin is also technically an NSAID, but it acts differently. The key difference lies in the COX enzymes. NSAIDs block 2 different enzymes, COX-1 and COX-2. COX-2 handles inflammation, but COX-1 helps protect your stomach lining and, crucially, affects platelet aggregation, or blood clotting. While aspirin selectively and permanently inhibits COX-1, the other NSAIDs, like ibuprofen, do it temporarily. In fact, studies have shown that if you take ibuprofen regularly, it can actually block the ability of aspirin to protect your heart by temporarily occupying the COX-1 binding site. If you are on an aspirin regimen, taking high doses of ibuprofen can essentially undo the life-saving benefit of your prescribed therapy. You need to take the aspirin at least 2 hours before or 8 hours after the ibuprofen dose. This is a life or death timing issue that few patients are aware of. For people with no known heart problems, the risk is lower but still present. But if you already have hypertension, heart failure, or are recovering from a heart attack, NSAIDs are essentially fuel on the fire. They block the action of other life-saving heart medications, especially diuretics, making it harder for your heart to pump and easier for fluid to build up in your lungs. Your over-the-counter painkiller is fighting your prescription heart drug. So who needs to be the most vigilant? If any of these describe you, you need to talk to your doctor immediately about every painkiller you take. The high-risk groups. Number 1, anyone with pre-existing hypertension. Your pressure is already high. You don't need a drug actively making it higher. People with heart failure, fluid retention is the enemy here. NSAIDs are designed to promote it. Seniors, your body's ability to process and eliminate these drugs slows down with age, meaning the cumulative effect happens faster. And anyone post-heart attack, your heart muscle is vulnerable. It cannot handle the added stress of fluid retention and vasoconstriction. But here's the trickiest part. It's not just the ibuprofen bottle. These same dangerous ingredients are hidden in countless other over-the-counter products. Think about your cold and flu medicine. Many of the big brands contain the exact same NSAIDs plus a vasoconstrictor. What does a vasoconstrictor do? It narrows your blood vessels to reduce nasal swelling. It physically narrows the highway. Now you have a drug that's forcing your body to retain water, and you have an ingredient that's squeezing your arteries shut. It's a cardiovascular double whammy, and cardiologists see emergency room visits skyrocket when cold and flu season hits. Read the labels. Specifically, look for drugs that contain decongestants like pseudoephedrine or phenylephrine combined with an NSAID. This combination is a straight shot to raising your blood pressure into a dangerous zone. Let's get technical for a moment, but stay with me. This is where the artery damage happens. Your blood vessels are lined with a fragile single layer of cells called the endothelium. This is the barrier that keeps your blood flowing smoothly. When you increase blood pressure, whether from diet, stress, or a pill, the high-pressure blood flow essentially scrapes against this lining, causing shear stress. This high-pressure environment caused by the NSAIDs creates microscopic tears and weak spots in the endothelium. Your body tries to fix these injuries, but it's a disastrous patch job. That's where plaque comes in. Cholesterol and other fatty materials rush in to fill the gap. It's the beginning of atherosclerosis, the hardening and narrowing of your arteries. This is a vicious cycle. The NSAID raises the pressure damages the arteries, the damage invites plaque, and the plaque makes the arteries even narrower, raising the pressure further. The NSAID didn't just relieve your pain, it secretly accelerated the process of artery damage that could lead to a catastrophic event. And one more thing, studies suggest some NSAIDs can also increase the tendency for blood to clot. You have a narrowed, damaged artery and blood that's more likely to clot? That is the perfect storm for a stroke or a heart attack. Many people assume if they stick to the lowest dose, they are safe, but the data shows that even at the lower, over-the-counter doses, the cardiovascular risks are present, particularly with regular use, over many months. And let's be honest, when the pain is bad, people often take more than the recommended dose. Cardiologists warn that once you cross the threshold of regular high-dose NSAID use, say 1,200 milligrams of ibuprofen daily for weeks, your risk profile skyrockets. The dose-response relationship for gastrointestinal bleeding is well known, but the dose-response for cardiovascular risk is just as alarming. If you are relying on these pills daily just to function, you are not treating pain. You are masking a serious underlying issue and severely increasing your heart risk. That daily back pain is a signal, not just something to silence. And there is a secondary danger to chronic use, kidney damage. The same way NSAIDs affect your blood pressure by manipulating fluid balance, they can decrease blood flow to your kidneys. Over years, this causes significant renal impairment, which in turn leads to even higher blood pressure, further accelerating the arterial damage. You are essentially trapped in a loop where the pill you take for relief is creating the next problem. So what do we do about that nagging headache or muscle pain? The good news is there are safer alternatives, but you must consult your doctor. Alternative number 1, acetaminophen. While it's not without its own risks, particularly liver damage if you exceed the limit, studies generally show it is significantly easier on the cardiovascular system than NSAIDs. Again, follow dosing limits, but it's often the safer first choice for heart patients. Instead of reaching for a pill that blocks the entire inflammation process and harms your arteries, let's talk about natural ways to reduce inflammation at the source. 1. Curcumin or turmeric. The active compound in turmeric is a powerful anti-inflammatory. Look for a high-quality supplement with black pepper extract, piperine, to increase absorption. 2. Omega-3 fatty acids. High doses of fish oil, EPA, and DHA are clinically proven to lower triglycerides and have potent anti-inflammatory effects that are cardioprotective, not damaging. 3. Magnesium. This vital mineral can help relax blood vessels, which works directly against the blood pressure-raising effect of NSAIDs. 4. Bromelain. An enzyme found in pineapple, often used to help reduce post-operative or post-injury swelling. Alternative number 2, lifestyle solutions. For chronic pain, look beyond the pill. Talk to a physical therapist. Consider a quality anti-inflammatory diet, one that is rich in colorful fruits, vegetables, and healthy